Hope you're doing great. It's been long we came here, so we will be looking at all the steps that you will need if you are trying to conceive. So we'll be looking at infections. We'll be looking at your hormones and which of the hormones, because it's not every hormone that will make it harder for you to conceive, but there are specific hormones. So we look at infections, we'll be looking at hormones and which hormones can make it harder for you to get pregnant. We'll be looking at fibroid, we'll be looking at endometriosis, we'll be looking at ovarian cyst, we'll be looking at what your partner plays does. What is that thing that your partner has to do in order for both of you to conceive, for both of you to have a family much more easily? We'll be looking at how weight plays a vital role for you to conceive. We'll be looking at how your mental health plays a vital role for you getting pregnant. So we will be discussing a whole lot. If this is your first time here, consider giving us a follow. If you have been here before, I really do appreciate it. Thank you so much. Also share the live stream and let others join us. So, in the name of the Almighty, most merciful, most glorious, may the peace and blessings of the Almighty be with you, guide you, protect you, show you the right path to follow. Have mercy upon you, have mercy upon your family, have mercy upon your loved ones, have mercy upon everyone else, including myself. Amen. Assalamu alaikum wa rahmatullahi wa barakatuh to all my Muslim brothers and sisters following this live stream. Thank you so much for joining us. Today we are looking at factors that affect fertility. We are looking at factors that affect fertility, and we're going totally into looking at all the various factors that may make it difficult for you getting pregnant, including infections, including hormones, including fibroid, endometriosis, ovarian cysts, including how your partner may make it harder for you to conceive, including how weight can make it difficult for you getting pregnant, including how your mental health plays a role, including your lifestyle, including the egg quality, how this egg quality of yours could make it harder for you to get pregnant. So if this is your first time here, please consider giving us a follow. Make sure you're following Women's Health Forum. Also share the live stream for others to join us. If you're trying to get pregnant, there are many things which you have to do. There are a lot of steps. Unfortunately, some of our sisters, once they try getting pregnant for 1 month, 2 months, 3 months, 4 months, and at times 5 months, they're already too worried, too disturbed, like what is happening, why I've not been able to conceive. It is important for us, ladies, to know that you might be fine and your partner is also fine, but you still have some sort of a delay in conceiving. That is why if you have tried getting pregnant, you need to continuously try for some time. And scientifically, your doctor will say that you have a fertility challenge if you have tried for like a year. Then your doctor can say, oh, you really have a fertility challenge and this should be looked at. If not, your doctor may just ask you to go and try. Let me say you have tried for 3 months, you've tried for 4 months, your doctor will just say, oh, 3 months is too small, 4 months, this month, go and try again for another 5 months. If not pregnancy, you come back. So the very first thing I want us to look at is infections. Under infection, there are specific types of infection we're talking about here. We are talking about infections such as chlamydia that can make it harder for you to get pregnant. Infections such as gonorrhea that can make it harder for you to get pregnant. Infections such as syphilis that can make it harder for you to get pregnant. Infection such as mycoplasma that can make it harder for you to get pregnant. If you're trying to conceive, you have not done this, it's important that you do it. If you're trying to get pregnant, chlamydia has not been done, gonorrhea has not been done, syphilis has not been done, mycoplasma has not been done, please try your best to do this, because this can make it much more harder for you to have your baby. The next are your hormones. Under hormones here, we have several hormones, but I'm going to list the most important that can make it harder for you to get pregnant. So under hormones, we have the LH and the FSH hormone. These two are chemical messengers that helps you to ovulate. So the eggs need to mature, and the most matured egg will be released. So you have the LH and the FSH. These two hormones helps you to ovulate. You will see at times you go visit your doctor tells you, oh, your hormones are not balanced. If your doctor says your hormones are not balanced, then it is possible that maybe the LH and the FSH are having, maybe LH is somehow a little bit down, FSH is right up. Or you have other type of hormones that are not within normal. There are different types of hormones that you can actually have an issue with, and it might be stopping you from getting pregnant. Not only LH and FSH, which are responsible for ovulation directly, we also have something like prolactin. So the prolactin hormone, is the hormone that helps ladies to actually breastfeed. So without the prolactin hormone, you will not be able to produce breast milk. So this hormone helps you to produce breast milk. But if you're trying for a baby, if you are trying to get pregnant, you don't need this hormone right now. If you're trying for, you don't need the hormone to go right up. That's what we mean. It's not like you don't need a hormone, but you don't need it to go right up because the hormone has other functions. So if you're trying to get pregnant, this prolactin hormone should be within normal. If not, it's going to stop ovulation. It's going to prevent ovulation. It's going to make it harder for you to ovulate. So prolactin is hormone that you need to look at if you're trying for a baby. Another hormone you need to look at is the testosterone hormone. The testosterone hormone. This hormone is actually a male hormone. The testosterone is a male hormone, and normally as men we produce, we have beard, we have muscles, our voice look heavy or sound heavy. It's due to this hormone, the testosterone hormone. That's the work of the hormone. By nature, a man is physically stronger than a woman. By nature. Yeah, we know that there are women who are stronger than men, but by nature, a man is physically stronger than a woman. And thank God, testosterone, this particular hormone, plays a role. So, as a lady, if this hormone, you test this hormone, you realize that it has gone up, then there's a problem. As a lady, if you want to check this hormone, you realize that it has gone up, not within normal, higher than it's supposed to be, then there's a serious problem. This might be linked to polycystic ovary syndrome, which causes an ovulation. It makes you not to ovulate. So, hormonal influence is at the backbone for ladies trying for a baby. Hormonal influence is at the backbone of ladies trying for a baby. If your testosterone hormone is higher than normal, there is a very high probability you might be suffering from polycystic ovary syndrome, which is a difficult situation. It's a situation in which this hormone is higher and you produce a lot of immature eggs, and these immature eggs cannot be released. It therefore means eventually you don't ovulate. And obviously, if you don't ovulate, you will not be able to get pregnant naturally. You can't be able to conceive without ovulation if it is not natural, but for you to conceive naturally, you need ovulation. Every lady needs ovulation in order for that lady to conceive naturally. So if you have checked this hormone, the testosterone hormone, the next thing that you need to look at, the next hormone will be the TSH hormone. The TSH hormone is thyroid stimulating hormone. It also helps with ovulation. Meaning, if this thyroid stimulating hormone is much more lower, then ovulation becomes difficult. Ovulation becomes difficult. The next is progesterone. Progesterone. Progesterone hormone, the main function of this hormone is to take in the walls of the endometrium. It is taking the walls of the womb, which is the endometrium, and this endometrium helps you when you eventually conceive, the baby stays. If your progesterone is lower than normal, then if you conceive, you will realize that this progesterone can cause you to have a miscarriage. Yes. So it is important for your progesterone level to be within normal. If it is not within normal, you might find it very difficult to sustain your pregnancy till term. The next thing here is fibroid. So you do a pelvic scan, and if a pelvic scan shows that you have fibroid, it's good to follow up with what your doctor is going to tell you. If your doctor says, all right, you can get pregnant with this fibroid, then you proceed with it. But if your doctor says getting pregnant with this fibroid will be difficult, it needs surgery to remove, please follow through with your doctor. Another is endometriosis. Endometriosis is another very difficult situation, which endometriosis, uterine polyps, and ovarian cysts. These are all very difficult situations in which if you have, let it be handled by your gynecologist, and the instructions the doctor will give you, please do it to follow this instruction. The next thing is your partner. Unfortunately, most of our sisters, when you do try, your partner might not want to do his checks. Encourage my brother to go and do his own checkup, please. Encourage my brother, tell my brother to go and do his own checkup, please. Men, let us do our work by doing our own checkups. Don't allow your woman to do it on her own. If you have been trying, if your wife has been trying for a very long time, it's good that you go for your checkup as well. So if your partner has done Then the next thing you need to look at is your weight, your partner's weight as well. That should be looked at because these actually help to produce poor quality eggs as well as poor quality sperm. The next is your mental health. Your mental health. If mentally you're worried, this can affect your hormones as well as makes it harder for you to get pregnant. Lifestyle. Lifestyle is the next. Under lifestyle, you were talking about drinking habits, smoking. If you're a drinker, you have to stop it. If you smoke, also stop it. Take a lot of water. Do take a lot of vegetable, a lot of fruit, and take much water, a lot of vegetable, lots of fruit, and then do regular exercises. The next is your egg quality. Your egg quality. If the quality of your egg is not the best, you might have a miscarriage. You might have a miscarriage. So your egg quality should be looked at. If the quality of the egg is not the very best, you might have a miscarriage or you might never conceive. So it's good to also check the egg quality, check the egg reserve and see. But your doctor will always request for this test because it's not generally done. So the egg quality, the egg reserve is not generally done, but your doctor will always look at it and then try to do it. Then if the egg quality and the egg reserve shows that you have low quality, your doctor will know how to correct it. Always work with your doctor. If there is any issue, let it be resolved. Let it be solved by your gynecologist. I wish every lady trying to get pregnant the very best. May the good Lord make it much more easier for you. Please, if you watch this video and it's insightful, do way to follow, do way to share. If you have a worry, you can use the number on the first comment of this video and you keep the word you get to us on WhatsApp if you want to if you want a one-on-one follow-up, you can use the number as well. May God bless you. I wish every lady the very best. Please let's be careful this December and not over enjoy. If not, you might destroy a whole lot of stuff. God bless you all. Do have a wonderful time. I hope this helps somebody somewhere. Thank you.